Hello, everyone. I'm Kibin Alleyne. Today is Tuesday, January 17th, and you are now watching Open, a live program bringing you the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Earlier this month, NFL star Damar Hamlin suddenly collapsed on the field mid-game, which caused some health professionals to suspect what he experienced could have potentially been caused by the rare heart condition known as Commotio-Cordis. Cardiologist for Montefiore Einstein Center for Heart Vascular Care, Dr. Andrew Krumerman, joined me to discuss Commotio-Cordis. Doctor, thank you so much for joining me.
Thank you for having me.
So, as I mentioned, I think this is a rare heart condition. It's definitely my first time, hearing about it. Can you just explain, what Commotio-Cordis is and how it affects your health?
Sure. So, Commotio-Cordis is Latin for agitation of the heart. And it's literally an agitation of one's heart. And it's a very rare condition that is caused by trauma at a very particular time in the cardiac cycle, such that typically an object, typically a ball, needs to hit the area of the chest just over the heart at a specific time that is about 30 to 40 milliseconds of the cardiac cycle. So if a average heart rate is 60, it's beating once per second. Within 30 milliseconds, within that second, you have to hit the heart just at the right place at just the right time. And if you're unlucky, you will develop a cardiac arrest because this forceful blow can cause something called ventricular fibrillation. And based on what's been reported and based on the events that occurred on the field that everybody was able to see during the game, appears to what has happened to Damar Hamlin.
Now, would you say, because you mentioned, the timing and stuff like that, would you say that's why it's considered a rare heart condition?
Yes. I mean, if we think about the number of NFL players and the number of NFL games and how rough this sport is and the number of hits that occur in a given game, we rarely see these instances. And although Commotio-Cordis is a known entity and it's been reported throughout the history of sports, it's rare, and you have to really be in the wrong place in the wrong time with a particular set of circumstances.
Despite it being somewhat rare or very rare, what are the risk factors associated with this health condition?
So there really are no risk factors. The risk factors are putting yourself into a contact situation. Typically, Commotio-Cordis has been described in sports that involve balls or pucks, such as baseball, hockey, lacrosse, and the ball needs to be hard. It needs to come at a certain velocity, and again, it needs to hit the chest just to the left side of the sternum, to the left side of the breastplate, and it has to hit the chest at just the right time in the cardiac cycle for all these for all this to come together. And so individuals themselves are not particularly at risk for developing Commotio-Cordis. It's rather their activities that put them at risk and how they behave during those activities.
Now, I'm so glad that you mentioned that because I wanted to know, is this something that can potentially, now that we know this, is this something that could happen to anybody? Or are there particular people who, I guess, are more at risk?
So no, this can happen to anybody. This does not happen to people who have a heart condition or a particular predisposition to Commotio-Cordis. That's not well described, and it's not known to be something that happens to only certain individuals with certain conditions. This can really happen to anybody.
Wow. So I think that's pretty alarming for a lot of people, even though it is rare. So I definitely want to keep mentioning that because I don't want anybody to watch this and be afraid or anything. So it definitely is rare. But now that you say that, are there any symptoms or of anything that people should maybe look out for? How does someone know that they're currently experiencing this?
So if you saw the video or you saw or you watched the game, you can see that this all happens suddenly. Commotio-Cordis can result in a condition called sudden cardiac death. So you don't really have symptoms. He was hit in the chest, he stood up, and within a couple of seconds, he fell backwards and passed out. And so you really don't have premonitory symptoms. It's not the kind of thing where you're starting to develop chest pain or you're having shortness of breath or you're feeling dizzy for hours before an event like this occurs. It's really something that happens all at once.
Wow. So, how is this similar or different to cardiac arrest?
So this is cardiac arrest. It's something that's causing cardiac arrest. But the majority of cardiac arrests that we see on the playing field are caused by uh, a condition called hypertrophic cardiomyopathy or ion channelopathies, which are electrical disorders of the heart, which are more congenital based disorders. Um, and those disorders are a little bit different in that patients may have some symptoms ahead of time, or they may have some family history of individuals dying at young ages and having cardiac arrest. Um, but this, in and of itself, is a cardiac arrest. Hard to predict. You can't really see it coming, and that's what's so scary about it.
And can you briefly explain for those who may not be aware, just what cardiac arrest is and, how that affects your health?
Or a cardiac arrest is effectively when the heart beats so rapidly that it doesn't even beat at all. So we consider cardiac arrest to be something when we're looking at heart rhythms called ventricular fibrillation or ventricular tachycardia. Uh, this is usually reversed by taking out something called an external defibrillator and shocking the heart to bring it back to its normal rhythm. And people may be familiar with medical programs and medical dramas on television where where doctors and nurses take out the paddles and rub them together and yell clear and shock the patient. Usually they're treating those patients for cardiac arrest.
Now, is trauma to the chest the only way to experience Commotio-Cordis?
Yes.
Okay, so now that we know that, as you mentioned previously, this condition is commonly associated with people in sports. Is there a way people in this field can protect themselves from something like this happening?
Sure. There's not a lot of data to support the use of one particular mechanism of protection, but really the best protection is avoidance. So, for example, if you're playing baseball and you're the batter and a pitch comes in, batters are taught to turn their back to the ball rather than to let the ball hit them in the chest. Similarly, if you're playing other sports where you might use your chest to block a ball coming at you, it's not a good idea. Um, there are pads that are sold that people can wear to help protect the left side and the center of the chest to reduce the effect of trauma. There's even safety balls in baseball, which are sometimes used for younger children's leagues to prevent blunt force trauma to the chest.
Now, I'd really like to know, after this happens to someone, is there any sort of treatment that they must go through, after they experience something like this?
Um, effectively, other than the resuscitation efforts that one must go through in order to have their lives saved, the rest becomes supportive. So, really, the mainstay of therapy for cardiac arrest, and especially in the setting of Commotio-Cordis, is CPR and rapid defibrillation. So, the fact that Damar Hamlin survived this horrible event is a testament to the rapid recognition of the problem and the rapid action of the crews on the field that came in and immediately administered CPR and defibrillation. And so this is really the mainstay of treatment. The rest becomes supportive care. The longer somebody is unconscious and suffering from cardiac arrest, the longer their organs don't get vital oxygen and can be damaged.
So I'm really glad that you mentioned that he survived, this experience. Is this something that often leads to death?
Well, yes, cardiac arrest can certainly lead to death, and approximately 50% of cases that have been reported of Commotio-Cordis do not survive.
Wow, wow, thank you so much for sharing that. Now, how can people stay educated about Commotio-Cordis?
So there are some guidelines that are published by the American Heart Association that really talk about both how players that are involved in sports should avoid the situations, and also how uh, systems should set up their coaching and their teams to allow for rapid recognition, CPR training, uh, automatic external defibrillator use, and training of that of AEDs, training of coaches and players to use AEDs in such situations. So that's the best way, is to really look towards the American Heart Association guidelines.
All right, doctor, thank you so much for joining me.
Thank you.
To stay updated with the Montefiore Einstein Center for Heart Vascular Care, please go to their website at www.montefiore.org/heart or follow them on Twitter at Montefiore Heart. Don't go away, we'll be right back with more Open right after this.